Hey everybody, you're watching a physio named Jonah. That's this guy. In today's video, I want to look at two words that are often used in everyday language that have very specific meanings in the world of rehab and healthcare. Now, the one-letter difference may not seem like it's that important, but it's actually a pretty big difference. I mean, think about it. It's the difference between a train and a prain. Maybe you're a healthcare student studying for a big test, or a patient who just got diagnosed with one of these two things, a sprain or a strain. Either way, my goal today is to help provide some clarification on what these two things are, what makes them similar, as well as different. Let's get started. Now, before we can talk about what a strain is versus what a sprain is, we have to review what makes a ligament different from a tendon. These are words that people often are aware of, but may not know exactly what they mean. A ligament is a connective tissue that connects one bone to another bone. Its primary purpose is to stabilize the two bones that is connecting together. A good example of this is your ACL, or anterior cruciate ligament. This is a ligament in the knee that most people are familiar with. It serves the purpose of providing stability between the femur, the thigh bone, and the tibia, the shin bone. A tendon is also a connective tissue, but it connects a muscle to a bone. This allows the muscle to pull on the bone and produce movement within the body. A good example of this is your Achilles tendon. This is the tendon at the back of your ankle that connects the muscles of your calf to your heel bone. As you can see, the difference between a ligament and a tendon is a ligament connects bone to bone and is focused on stability, while a tendon connects muscle to bone and is much more focused on movement. Now that we have a better understanding of what the difference is between a ligament and a tendon, let's get back to the main goal of today's video. What is this? A sprain, with a P, is an injury, specifically a stretch or tear to a ligament. A strain, with a T, is an injury, specifically a stretch or tear to a tendon or muscle. So, looking at the beautifully curated thumbnail for today's video, this would not be possible to sprain the bicep. If the biceps muscle was injured, it would be a strain. But I hear you out there from behind that camera, talking to your phone or your iPad. What happens when we sprain or strain something in the body? Hello? In addition to pain, a ligament sprain often leads to some instability or perceived sense of increased stretch around the joint. This is because ligaments connect bones to other bones, so stretching that or tearing that is going to cause some increased laxity or instability around that joint. In comparison, a muscle or tendon strain will often cause pain as well, but is more likely to cause a weakness as opposed to an instability. This is because the tendon and muscle are more focused on movement, connecting muscles to bones, as opposed to stabilizing joints like ligaments. But don't worry, I am going to try and confuse you more. Both sprains and strains have grades associated with them that classify their severity. Ligament sprains are graded based off of how many fibers of the ligament have been torn, as well as what kind of symptoms the patient is experiencing. A grade 1 sprain is the mildest ligament sprain, involving some stretching only or minimal tearing of the ligament with some mild pain. A grade 2 ligament sprain is an incomplete tearing of the ligament with moderate pain, likely some swelling and bruising to go along with it. A grade 3 ligament sprain involves a complete tear of the ligament. There's often severe pain, swelling, and bruising that go along with this. Keep those grades for ligament sprains in the back of your mind, because the way we grade muscle or tendon strains is incredibly similar. A grade 1 muscle strain has minimal fibers being torn with a minimal loss of muscle strength or motion. A grade 2 muscle strain, on the other hand, has a moderate number of fibers being torn with a moderate loss of muscle strength and motion. It's a little more severe, and there may also be bruising or swelling associated here. A grade 3 muscle strain is a complete rupture of the muscle or tendon and has a complete loss of muscle strength to go along with it. This is a case where the muscle is completely torn. There's no longer any connection from the muscle to the bone. These grades are really helpful in communicating between healthcare professionals as well as with patients about the severity of their injury. It gives us a common language of how to talk about the severity of sprains or strains. I mean, even without being a healthcare practitioner, I'm sure you can imagine that we're going to treat a grade 3 strain or complete rupture of the muscle belly in the pec very differently from a grade 1 sprain or mild stretching of the ligament in the ankle. At least I hope you would. So how do we tell a ligament sprain from a muscle strain? How do we know if it was a ligament that was damaged or if it was a muscle? The honest answer to this is that it takes multiple factors and some clinical reasoning to figure this out, and working with a healthcare practitioner is always the best way to do this. Cats can help as well. I am going to give a couple quick notes here though on how you can try to tell one from the other. Hey pen. Let's say someone rolls their ankle. Whoa! Their foot rolls underneath of them like so. It happens to the best of us. Now we're left with an ankle injury that hurts at the side of the ankle because the foot rolled inwards or towards the middle. Now, this athletic specimen of a human being could have done a few things to his ankle. He could have sprained the ligament in the side of his ankle, the ATFL, or he could have strained some of the muscles in the side of his calf and ankle as well, the fibularis muscles to be specific. Pulling the foot back towards the middle like so is probably going to hurt no matter what. Either way, we're pulling on a ligament that was stretched and possibly torn, or pulling on muscle fiber and tendon that was possibly stretched or torn. Looking for a patch of swelling on the side of the ankle may suggest that a sprain was more likely, but is not always a 100% guarantee, as we can get swelling or bruising with muscle strains as well. Something that can help differentiate between ligament and muscle though is moving the ankle back towards the side that was injured or that was rolled away from during the injury. If it doesn't make the ankle hurt more, this may suggest the ankle was sprained. Moving the ankle towards the ligament that holds bones together is not going to stretch the ligament, so it may not increase the pain that is noticed there. If this is painful though, it may suggest that a muscle strain is more likely, as by moving the ankle towards the side that was pulled on is going to use the muscle fibers on that side of the ankle. If this is painful, it may mean that strain is your more likely diagnosis. Because these tissues are different in terms of one contracting and one not contracting, we can use this to our advantage as we determine a sprain or a strain. I mean, sometimes. If Buddy from this example sprained his ankle really badly and there's swelling everywhere, it's a lot harder to tell sometimes because everything will hurt, but in that case, please go see a healthcare professional. Please don't try and figure this out on your own. Go see somebody. Go get that looked after. In conclusion, to finish up here, sprains and strains may sound similar, and they kind of are, but also they aren't. They are both injuries that affect tissues that connect bones to other bones within the body. The difference is in what these tissues are. Because a ligament is very different from a muscle or a tendon, the difference in an injury to a ligament, a sprain, or an injury to a muscle tendon, a strain, is going to be fairly different and require different things in terms of healing. I hope that today's video helped you understand a little more about what a sprain is versus what a strain is, how to use one term versus another, whether you're talking to another healthcare provider, patients, whatever it may be. If you enjoyed the video, consider subscribing to the channel. This will get you notified when I release new videos if you hit that bell, and also help support the channel, which is greatly appreciated. You can also support this video by leaving a thumbs up below. Drop me a question in the comments section if you have any brewing thoughts after watching this video. I usually get back to people fairly quickly, so I look forward to talking to you there. Most importantly though, guys, as always, move your body, have a laugh today, and I will see you at the next video. See ya. What do you think, Penny? Was that good? I'll take that as a win.